Warahmatullahi Wabarakatuh. My name is Ain. Today I would like to present case for OPD2, which is nutrition management in bladder carcinoma post-chemotherapy. This is the content for today's presentation. For nutrition assessment, first is client history, which this patient is Madam M.A., 51 years old, mother of two. Patient diagnosed with bladder carcinoma in 2019 with underlying of hypertension and anemia. And patient reported have completed 5 cycles of chemotherapy in January 2020. And patient complained of persistent weight loss since started treatment. Patient is a housewife and her husband works as engineer at private company. Patient was referred to dietitian on 15th of February as outpatient for weight problem. For anthropometry, on 15th of February shows that patient weight is 46 kg with height of 1.54 meter and BMI 19.4, which is normal. So based on overall weight changes, shows that patient have 6% weight loss, which is around 3 kg weight reduction after completed chemotherapy, which is around January. And patient have 16% weight loss, which is around 9 kg in 6 months, which is from September to February, which is considered as severe weight loss. And ID body weight, which is at BMI 22.5, shows that it is 50.3 kg. So for biochemical data shows that renal profile is normal except for magnesium, which is lower than normal range. For liver function test is normal. However, for full blood count, which is for hemoglobin, is lower than normal range, which is as patient is diagnosed with anemia. And for magnesium and hemoglobin low might be due to chemotherapy, which patient had completed in January 2020. This is the medication that patient had been taken, and for treatment, patient reported had completed 5 cycles of chemotherapy in January 2020. For nutrition focused physical findings shows that patient reported to still be able to do house chores but complain of easily get tired, and patient also reported to have low appetite, especially on sick day. This is food and nutrition related history, and overall the history shows that estimated intake per day is around 1,182 kcal per day, with 77% of carbohydrate, 7% of protein, and 15% of fat. So patients seems to have a low protein intake, as patient only take half pieces of chicken and fish during lunch, and patient tend to take small portion of food for every main meal, which is during breakfast, lunch, and dinner. As patient reported to have easy to feel fullness after just a few bites or spoons. Patient also like to eat fruits or drink fruit juice as a snack, and patients have a low fiber intake. Patient also like to take 3-in-1 coffee 1 to 2 times per day. For dietary requirement, first the energy requirement by using quick method, which is using ID body weight, shows that patient estimated energy requirement is around 1,600 kcal per day. By using Mifflin Sanju using current body weight shows that patient energy requirement is around 1,700 kcal per day. Next is protein requirement. By using 1.5 gram per kg times with ID body weight shows that patient protein requirement is around 80 gram per day. Food requirement by using Promid O 2002 formula, patient diet food requirement is around 1,890 ml per day. For nutrition diagnosis shows that patient there is inadequate protein energy intake related to decreased ability to consume sufficient protein and energy due to poor appetite, as evidenced by estimated energy intake is around 1,200 kcal and protein is around 21 gram, which is lower than requirement is 1,600 kcal per day with 80 gram of protein per day. For nutrition intervention, the goal is to provide adequate energy and protein intake to minimize further decline on nutritional status and to prevent from further weight loss. And the intervention that can be done is by educate patient the importance of adequate energy intake to help it recover after complete chemotherapy, to encourage patient to have small but frequent meal, which is breakfast, morning tea, lunch, afternoon tea, dinner, and supper. And next is to educate patient on protein sources, which is for example like eggs, fish, chicken, tofu, and importance of protein for recovery. Next is to encourage patient to take calorie dense food, which is for example like instead of taking cream cracker, she can change to peanut butter biscuits, which is higher in calorie. And next is instead of drinking fruit juice, patient can take fruit-based dessert such as pudding or smoothie as a snacks. Next is to educate patient on types of high salt food. For example, like belacan, soy sauce, tom yum, and teach patient on sodium counting as this patient have hypertension. Next is to advise patient to reduce intake of caffeinated drink, as caffeinated drink can reduce the absorption of iron, as this patient was diagnosed with anemia. Next is to indent oral nutrition supplement as below, which is 9 scoops of brochure with 1 scoop of biotin, adding 250 ml of water 2 times per day, which will provide 682 kilocal with 42 gram of protein. As this patient have low appetite, so by adding the oral nutrition supplement, it can add up more calories to make sure the calories intake are adequate for this patient. Next is to do light exercise to stimulate digestion at least 30 minutes per day, as suggests for this patient is like for 50 minutes in the morning and with 50 minutes in the evening. For example, like walking or stretching. Next is the nutrition monitoring and evaluation. So for next follow-up, can monitor the weight changes to monitor the biochemical data, which is renal profile, liver function test, and full blood count. Next is to monitor dietary changes and compliance to oral nutrition supplement, and to monitor on patient blood pressure. So for discussion, based throughout this case, improving energy and protein intake is the first step in nutrition intervention for weight loss in cancer patient. And protein requirement for this patient, which is before and after therapy, is around 0.1 to 1.5 gram per kg body weight, based on Insulin et al. 2004. And recent guidelines shows that suggests higher range of protein because it is likely give beneficial effects for treatment tolerance and efficiency. And ONS or N-tube feeding offer a possibility of increasing and ensuring nutrition intake in cases where if patient cannot take normal food adequately. As for this patient are having early satiety. So based on medical nutrition therapy for cancer 2013, give some of the tips on how to manage early satiety case. As for this patient, we can suggest eat small frequent meal with nutrient dense meal and snacks by adding protein and calories to food and favorite foods, drink nutrient dense liquid diet, or by adding ONS. Avoid fried or greasy rich foods which can take longer to digest. Avoid gaseous food which can cause bloating. Have a meal when you can eat most bread. For example, for this patient, you can ask by asking patient which time that patient prefer to eat more. So we can suggest patient to eat add more types of meal at that time and do light exercises. Next is higher bioavailability of dietary iron can be achieved by increasing the content of food component enhancing iron absorption, like ascorbic acid, meat, fish, to enhance more iron absorption. So for this patient, we can suggest, for example, like types of fruit that high in vitamin C, such as guava, orange, lemon, something with this type of fruit, this patient can use to make as a snack or to make as a dessert. Next is a factor that can cause anemia in cancer patient. First, oxidative stress, which also can increase the fragility of erythrocyte, which is red blood cell, and decrease the amount of erythroid maturation and reduce red cell survival. Next is the presence of inflammatory process, which is during chemotherapy, or will cause iron availability to reduce about 44% from normal range. And lastly, poor nutrition can cause deficiency of specific components such as iron, vitamins, vitamin folic acid, and etc., which is essential for erythropoiesis. That's all for me. Thank you.